Traditionally, the majority of mental health diagnoses, including ADHD, are made from observations, clinical questionnaires, and rating scales. Since everyone has different standards and expectations, these diagnoses tend to be highly subjective. What's more, a diagnosis based on observed behaviors and difficulties sees only symptoms, but not their underlying cause. Crucially, similar symptoms and behaviors can have quite different underlying causes, which is why medication is frequently a trial and error process, and often has unwanted results. Qeeg brain mapping removes the subjectivity of diagnosis by measuring actual brain activity, comparing it to a carefully screened database of normal activity for people of the same age, gender, and handedness. The difference between the measured brain we record and the clinical database of normal and expected brain activity is then described numerically in terms of standard deviations from the norm. Qeeg brain mapping therefore allows us to see and measure brain activity, allowing us to see and quantify the underlying causes behind the symptoms. This leads to a far more accurate diagnosis and even helps us understand what medications may or may not help. With Qeeg brain mapping, we can see and measure the frontal slowing associated with ADHD, the racing brain that comes with anxiety, or the low arousal states associated with depression. In terms of concussion and other brain injuries, we're able to gauge the likelihood and the extent of injury. Our analysis even allows us to measure connectivity between brain regions, allowing us to deduce specific functional deficits. But accurate diagnosis is only the beginning. Our goal is not just to measure function, but to improve it. Qeeg brain mapping shows us exactly what needs to change to improve cognitive function, and how to change it to reduce symptoms. Mapping brain function is the essential first step in our treatment plan, allowing us to see how neurofeedback can be used to resolve the issues we've identified as problematic, to improve function, and to reduce or eliminate symptoms. Finally, Qeeg brain mapping allows us to do something unique in the field of mental health. By comparing brain maps before, during, and after treatment, we're able to quantify treatment success, holding us to the highest clinical standards and our continuing commitment to your treatment success.